So, Tom, there are different checkpoint inhibitors that are approved. In the first-line setting, right now, pembrolizumab is the one that's approved. But in the second line, we have nivolumab, we have pembrolizumab, we have atezolizumab as monotherapy. And do you see any differences between these different drugs?
So I think the second-line immunotherapy naive patient population is rapidly declining in terms of the number of patients we see. But we do still see them. And most of the time, I don't think that there's a strong efficacy or a toxicity difference between the three. I often decide on schedule as the main thing, and the nivolumab can be given every 4 weeks, the pembrolizumab and the atezo every 3 weeks, and I think those are the factors more so than the differences in the data.
Yeah, I think schedule was definitely driving us. Now, are you giving nivolumab every 4 weeks? I have not. That data came from more PK/PD as opposed to the efficacy data. So I admit I'm sort of giving 6 months of every 2 weeks if I'm using it, and then going to every 4 weeks. What are you guys doing? Are you straight out every 4 weeks, no problem, when you're using it?
I am using every 4 weeks. I was very involved in the Checkmate 384 study, which actually was randomized to that question. So I'm not sure I've ever been involved in such what will probably be such useless data presentation, because in fact they now are both approved, and unless there's a huge discrepancy between the two of them, I think both of them would continue to be used. I have gone to the every 4 week. I think that when one looks at the dose range on studies to date, there's very little to indicate that there's a huge difference. And so I do have comfort with that every 4 week regimen.
I use it every 4 week, and I think some patients travel a lot. Sometimes they can be on this therapy for a long time, so it does make the patient's quality of life better. So.
Absolutely. 26 versus 13 visits a year is a dramatic difference in terms of quality of life.
Anyone who's spent much time on the 405 would like to come in less frequently to the clinic in LA rather than more.
Fair enough. And Tom has mountains to travel sometimes to get to his cancer center.